Good evening, all. Myself, Anandha Vishnu. I'm an embryologist. I have done my master's from KMC Manipal, and I've been working with Nova since 2019. And I'm here to share some information on basics of embryology. Nova is one of the top fertility clinics in India with 25 centers in 18 cities across the country. These are the places where we have already established and working nicely. Nova's labs are modular with the latest developments where we have highly skilled, dedicated embryologists and clinicians with continuous update of their knowledge and also are involved in the research of emerging technologies to provide the best quality treatment in assisted reproduction in collaboration with internationally renowned chain of IVF clinics. The tertiary centers of NOVA have new technology instruments like benchtop incubators, Embryoscope, diode laser, with advanced assisted reproductive techniques like testicular biopsy, ovum donation, sperm donation, and pre-implantation genetic testing with oocyte vitrification, especially for fertility and oncological reasons. This is a representative image of IVF OT where the ovum retrieval procedures are done under anesthesia and sonography guidance, which is adjacent to IVF lab. Both our IVF lab and OT have an HVAC, which is also known as heating, ventilation, and air conditioning system to monitor the temperature, humidity, and other physical parameters. An air handling unit is used to recondition and circulate the purified air which is a part of HVAC system. Along with that, our labs are covered with epoxy coated sheets and flooring is of polyvinyl chlorine sheets. All these together reduces the chances of contamination and in turn gives an ideal condition for the embryo or gamete manipulation. Ovum pickup is the procedure to recover oocyte cumulus complex or OCCs contained in the follicular fluid through echogated puncture of ovarian follicle with a transvaginal needle. Once the follicular fluid is connected in a tube and is passed on to embryology lab where the screening is done for the ovum. During the screening, the tubes containing follicular fluid are poured one by one onto a preheated Petri plate. Then the OCCs are picked using a glass pipette and transferred into a dish with which containing gamete buffer. This is a representative image of Nova's embryology lab setup. The main workstation or laminar airflow is with two stereo microscopes or stereoscopes to check the follicular fluid by two people at a time. During OPU procedure to rule out the chances of missing OCCs. So we don't miss any OCCs in NOVA. Immediately after washing of the OCCs are kept inside the benchtop incubators. These are the benchtop incubators. For culturing the embryos, we use Min incubators from Cook Company from Australia. Min incubators are microprocessor controlled, gassed, and humidified incubators. The heated incubator, the heated chamber of the chamber base plate and the lid provide a stable environment, thermal environment for embryo culture. The specialty of our Ming incubators is having 24/7 digital monitoring and recording of temperature and gas flow, which helps us tracking the status of our device. These incubators have rapid pH recoveries, which maintain homeostasis. And also we have Vitrolife's Embryoscope incubators from Sweden. The Embryoscope incubators work on time-lapse technology, basically embryo dynamics, they matters, which includes observational time restrictions and stress to the embryo during culture or assessment. With time-lapse, we establish an undisturbed culture and continuous image acquisition, which ultimately improve in selecting the best embryo for transfer or freezing. These are the representative inside images of the incubators that we use in the lab. The left side is a conventional box incubator, and basically this is used to equilibration of oil. And right side Mink incubators, which is used for cultures. Hyaluronidase treatment. Before ICSI, we carry out denudation, which is the removal of cumulus cells from oocyte, both by mechanically and enzymatically. The enzyme we use as hyaluronidase, and we check for the maturity. X after hyaluronidase treatment will be looking like this. The extreme right image is a metaphase 2 oocyte, which is a mature oocyte and is used for ICSI, whereas metaphase 1 and geminal vesicle or GB oocyte are unsuitable for ICSI because they are immature and we don't use them for ICSI. The presence of polar body in metaphase 2 oocyte differentiate it from metaphase 1 oocyte. Then we proceed to ICSI. ICSI plate. The ICSI plate is specifically designed to support and facilitate the ICSI procedure to make our way of working easier and more effective. All the dishes that we use inside the embryology lab are quality controlled and certified. This is the representative image of the dishes that we use for ICSI. It contains media droplets which hold the oocyte and a streak of PVP where we load spermatozoa or at one end of the streak depending upon the concentration. PVP slows down the movement of sperm and hence it aids in the sperm selection and immobilization. This is the instrument that is used to carry out microinjection process, and it is called as micro manipulator. The microscope is Olympus IX70 and the micro manipulator used here is Narishige in the image with a Hoffman modulation. And this is a hanging joystick. These are micro injectors. These both injectors are hydraulic. This is a representative image of ICSI where the oocyte is held by a holding pipette at 12 o'clock position or 6 o'clock position concerning the polar body to allow injection through a 3 o'clock position. This facilitates the formation of zygote. In conventional IVF, one single OCC is inseminated, that is one single oocyte cumulus complex without denudation is inseminated with a certain concentration of spermatozoa. Depending upon the oocyte morphology, we decide whether it should go for the concentration is determined. In this procedure, the sperm selection is done by oocyte itself, and it is kept under it's kept undisturbed for a period of 16 to 18 hours to allow fertilization to happen. After 16 to 18 hours, oocytes are washed and checked for fertilization. So the sperm selection over here is even more natural. After 16 to 18 hours post ICSI, we check for the fertilization for the presence of two pronuclei and two polar bodies. If the number of pronuclei are high or more or less than 2, it is abnormal, and we have to discard those ones. Absence of pronuclei and second polar body indicates the egg is not fertilized. Post fertilization, embryo undergoes a series of cell division followed by cell differentiation, which ultimately give rise to a blastocyst. These are the representative images of a 2-cell, a 4-cell, an 8-cell, a compacting morula, an expanded blastocyst, and a hatching blastocyst. And these are graded or checked according to the standardized time related to the insemination time as shown in this figure. So fertilization check is done 17 hours plus or minus 1. That is in a pronuclear stage. Syngamy check is done at 23 plus or minus 1 hour. Whereas early cleavage check depends upon the type of insemination. Whether it is an ICSI, it will be at 26 plus or minus 1. And if it is IVF, it will be 28 plus or minus 1 post IVF. Whereas day 2 check, it will be done 44 hours plus or minus 1. And it should be 4-cell stage. Day 3 assessment is done at 68 hours plus or minus 1, and it should be 8-cell stage. Day 4 assessment is done at 92 plus or minus 2 hours, and it should be morula. And day 5 assessment is done at 116 plus or minus 2 hours, and it should be a blastocyst. So an ideal embryo should follow this pre-implantation timeline, embryo timeline. Hatching or drilling of Zona. Zona is an outermost layer of oocyte. During implantation, the embryo has to hatch out of Zona pellucida to attach and adhere to endometrium. It can be done artificially with the aid of laser when it fails to happen naturally. Even mechanically also can be done. This is the representative image on the right side. And the procedure is suggested only for indicative patients like with high basal FSH, then recurrent implantation failures, then Zona hardening like prior after frozen thaw, and advanced maternal age. PGT. PGT is defined as a test performed to analyze the DNA from oocytes, that is polar body, or embryos, cleavage embryos, or blastocysts, for determining genetic abnormalities. This includes PGT for aneuploidy, that is PGT-A, PGT for monogenic or single gene defects, that is PGT-M, or PGT for chromosomal structural rearrangements, that is PGT-SR. Even PGT is also indicative, like patients with advanced maternal age, repeated implantation failure, recurrent miscarriages, then a severe male factor, and any non genetic abnormalities. Vitrification. This is a method used to preserve oocytes or embryos after dehydration and incorporation of permeable cryoprotectants for an indefinite period after without altering their structure and physiology. So in vitrification, the material, that is oocyte or embryo, which is at 37 degree, is directly vitrified to minus 196 degrees centigrade. So it is very fast, and it is used nowadays worldwide, except a few countries. Embryo vitrification, the device that we use in NOVA is Kitasatos cryotop, where we load embryos. Prior to that, we treat the embryos or oocytes to various solutions like equilibration solution, then vitrification solution, and then we load it as shown in the picture and aspirate the excess media, and we plunge it inside the liquid nitrogen, and we cap it and keep it inside the liquid nitrogen tanks. We will not take it out till thaw or like FET procedures, until the FET. So thawing, as in when the embryo or frozen embryos are required for the procedure like frozen embryo transfer, embryos are removed out of the liquid nitrogen and they are brought back into the normal state. So this is a representative image of survived blastomeres of a day 3 embryo, and this is a degenerated blastomeres. 99% we get survival. In certain circumstances, depending upon the quality of the embryo, when we have no option, we had to freeze them, then that time, so we might face such degenerated blastomeres. Embryo transfer. Embryo transfer is done in such a way where embryos are loaded onto the catheter with a media column by an air column, followed by an air column, then a column of media with embryos, followed by air and media column. This is known as sandwich method, as the embryo column is sandwiched between air and media column. So this is a representative image of the tip of the catheters. This is the outer and this is the inner one where we load the embryos. A single determination of serum beta human chorionic gonadotropin, otherwise beta HCG, 14 days after embryo transfer is established and reliable early indicator of pregnancy after medically assisted reproduction. Regarding a prospect, we are planning to include sperm and oocyte banking with ovarian tissue cryopreservation. Semen cryopreservation is done in such a way where the sample is mixed with cryoprotectants. Equal amount of semen sample will be taken with the cryoprotectant or freezing medium, and it is mixed and it is exposed slowly to the extreme temperature. Like, so it will be, this is the representative image where the vial will be mixed with semen sample and the freezing medium, and it will be kept in room temperature for like 10 minutes. After that, it will be transferred into a liquid nitrogen tank, not into liquid nitrogen, only to the vapor phase for 3 to 4 hours maximum. Then after that, we will transfer it to the liquid nitrogen, and this is for long-term storage. So these are the devices where we can store when the concentration is very less. These are straws, semen straws, storing devices, and it can be kept inside these viscose tubes. and these viscotubes goes inside the liquid nitrogen tanks. Oocyte and ovarian tissue cryopreservation is also an option for patients who wish to undergo fertility preservation or for like prior chemotherapy. So here the oocyte is frozen in such a way that it is treated with a basic solution for, and then with an equilibration solution for 10 to 12 minutes. Then after that it is treated like finally in vitrification solution. After that it is loaded as same as that of embryo, and it is plunged into the liquid nitrogen, and it is stored inside the liquid nitrogen. Then the thawing remains the same for the embryos and oocyte, where the thawing media will be containing a 1 molar sucrose with a gradual decrease in the concentration of sucrose in three medias like thawing media, then dilution media, then wash media. These will be having like low concentration of, it will consistently low concentrations of uh, sucrose, like 0.5 molar in dilution solution. Either it might than 0.25 to 1, or even without sucrose in wash solution with a high amount of albumin. So thawing is a process of like 10 minutes and it will be done, and the thawed oocytes will be looking like the H, image H. Then ovarian tissue cryopreservation is still under progress. We are trying to give ovarian tissue cryopreservation as a treatment option in the future. So in ovarian tissue, we take small slices of the tissue, and it is having a device like known as a cassette. So these are kept inside these cassette, and they are again treated with the same, a mixture of DMSO and ethylene glycol with sucrose. So with the gradual exposure, these will be dehydrated, and after that it is kept inside the liquid nitrogen. And also it is having various devices which can be used like normal semen storing vials with needles inside, so we just prick it and we keep it inside. So such variety in, devices are available, but still it is under experiments right now, and we are planning to give it as an option in the future. Thank you.
So we request doctors, in case if there is any question, please unmute and you can ask. And we have Dr. Yashoda Kiran, our senior embryologist from Chennai as well in this group.
Request doctor, you can share your queries in the chat room also. So there is a small announcement. Tomorrow we have another important session on advanced techniques in ART by Dr. Swapna ma'am, sharp at 4 p.m. Okay, we will end up with this session. Thank you so much to all the doctors for spending your valuable time with Nova IVF Basic Infertility Training Program. So I have seen one message. The question from Dr. Kavita ma'am. So what is the chance of contamination by coronavirus during the procedure?
Hello, ma'am. Hi, ma'am. So, if there is, so we do prior screenings for coronavirus right now. If there is a infection, we cancel the procedure and we stop the stimulations as of now.
So another question, in lab while handling gametes. The question.
The same thing, ma'am. So we will be doing like second scanning while this stimulation is going on. So we are doing coronavirus COVID-19 tests for those patients or even for donors. So if we find anything positive, so we cancel it, the stimulation, and we don't take it further.
The question is, Kavita ma'am, again, the doctors also have to do testing.
Ma'am, I didn't understand your question. Can you please?
The doctors also have to do testing. Embryologists especially.
Ma'am, I'm afraid I didn't understand your question. So of course, I think are you asking about are we doing testing for ourselves, whether we are taking prior uh, like testings, whether we are doing or not for ourselves. So ma'am, so if in any case any exposure, like if there is any COVID patients have visited the clinic, so obviously we have done in our one of our centers. So we go for like testing all the staffs, not just doctors or embryologists, the entire staffs. Thank you, ma'am.
Vishnu, we can end up this session.
Okay. Thank you all.
Doctor, the session was completed. Tomorrow you can join at 4 p.m. Thank you. Dr. Garu, the session was completed. You can join tomorrow sharp at 4 p.m.